welcome you all to the third edition of the FESA series of FSAI Hyderabad. This being the second edition of FESA for the pharma industry. The first FESA on the pharma industry was conducted in November 2024 under the leadership of Mr. Prasad Nishtala, and it was a huge success. We at FSAI Hyderabad appreciate and applaud the active support and participation of CEP, the Council of EHS Professionals, in helping us put together this one-day conference, FESA2026 for the pharma, right in the heart of the oldest pharma cluster of this region. We have selected very relevant topics across fire safety, static and electrical safety, security and automation. Besides these knowledge-sharing sessions, a power-packed panel moderated by a veteran from this industry will deliberate on the gap assessment beyond statutory and regulatory compliance. We are confident that all of these will surely go a long way in strengthening this sector, as today we are presenting it to those who can lead from the front to change. FESA 2026 seeks to drive a shift from firefighting to fire prevention, compliance to continuous safety, and reactive response to predictive risk management. Pharma fire safety cannot begin with a fire alarm. It must begin with hazard identification at the design stage and continue throughout the life of the plant. The ultimate objective should be zero fire rather than merely zero fatality, creating safer, more resilient and future-ready pharmaceutical facilities. The Hyderabad pharma sector's central challenge is not the absence of safety technology. It is ensuring that fire protection, process safety, electrical integrity, life safety and physical cyber security operate as one continuously managed risk system. The experience in Pasha Mailaram last year also demonstrates why a risk-based, independent and periodic audit model rather than a one-time compliance inspection is increasingly important. FSAI was established in the year 2002 and has chapters across 23 cities and the UAE, working closely with the government and all the stakeholders to enable the Indian fire and security industry to reach global preeminence with better regulatory framework. The mission is to establish life safety and security as an important human obligation in the economic development, and the goal is to foster a spirit of safe living among all citizens of the country and inculcate a proactive mindset towards safety by continuous awareness programs. As FSAI Hyderabad chapter sees itself as a bridge between the stakeholders, our objective is not to question regulation but to facilitate informed dialogue, identify practical challenges and contribute constructively for better implementation. Let us today work together and make Telangana not only a state of rapid development but also a state where every development is built with safety, responsibility and resilience at its foundation. On behalf of FSAI Hyderabad chapter, I thank you all, our distinguished guests and participants, for being here and wish you all a very productive and meaningful conference ahead. Thank you.
Manufacture, storage and import of hazardous chemical rules 1989. This gives three levels of responsibilities for the chemical factories. The primary level is identification of the hazards. The primary responsibility is identification of hazards in any chemical process, either during maintenance or handling of the chemical, storage of the chemical, transfer of the chemical, processing of the chemicals and various reactions, and during the maintenance. What are the possible hazards in these industries that should be identified, and the information should be given to the department. The information to be given to the department is a statutory obligation, but identification and dissemination hazards prevailing in that particular industry and train the people to cope up with those hazards, and whatever remedial measures management may take to avoid those hazards. Unless the employees working there are aware of the actual hazards, they may not appreciate your remedial measures. They may not be following the remedial measures, they will try to take the shortcuts. So that is the reason first step is the identification and dissemination of those hazards to all the concerned. Manufacture, storage of and import of hazardous chemical rules also requires you to tell to not only to the employees, to the neighbors also. What are the hazards prevailing in this industry and what measures the industry is taking, and in that industry, what neighbors should do. So the information that is required to be given to employees may differ from that is required to be given to the neighbors, but neighbors at least should know what they should do in case of emergency. If some emergency alarm is raised, one kind of emergency alarm is raised, what they should do. Another kind of emergency alarm is raised, what they should do. At least this information should be disseminated to the neighboring public through the local administration. This is what the MSAC rules specifies. This is the first tier responsibility. The second tier responsibility is the preparation of on-site emergency plan. In preparation of the on-site emergency plan for meeting the emergency, firefighting is definitely one of the important aspect in that. Some metal sheet that met by workers manually, it touched the overhead line, and 5 persons died in the incident. 5 persons died in the incident in Jeedimetla phase 4, almost 20 years back. And on the same day, there was an incident in chemical factory in Jeedimetla, fire accident. No injuries, which was contained in 30 to 35 minutes because the fire station is nearby and the people are active. They could control the fire within 30 minutes. No injuries, not major property damage. But the next day newspaper highlighted the fire incident, not the death of 5 people in an engineering industry. That is the reason we should be more. It is not only for public awareness. We need to be more careful regarding the fire, because the kind of accident that can take place in an engineering industry or with some other equipment or some other thing, one place only. It will be limited to that particular part. It may be limited to that particular person or that particular machinery. Issues under OSH code, central government is empowered to issue the directions now. So whatever factories rules earlier there, giving the directions on safety, almost 90% of these things central government is going to prescribe to have a uniform standards of safety throughout the country. In that, they may prescribe some fire safety norms also. But what are their norms? Definitely, state government fire safety norms will be more useful for us, and we have to follow whatever those norms are there, whether it is applicable to them or not.
Yeah, this is the FESA, the Fire Electrical Safety Association and Automation, that for pharma industries, they have taken this program for 2 days. I really appreciate that effort of the FSI for taking the pharma industry in Hyderabad is a lifeline. And in terms of revenue generation, it is the highest revenue generation as a standalone sector. But when we talk that fire and safety on pharma industries, see, the first thing what is coming in our mind, that though we are manufacturing life-saving drugs, this is our job. We are manufacturing life-saving drugs for the patient to reduce the burden of the patient, whatever. We are serving across the globe. But most of the process in pharma sectors is life-threatening to the environment and the people. This is the paradox of pharma industries, what we are doing or what we are serving for the society. If you take any process, any chemicals available in this earth, it is used in pharma industry either directly or indirectly or in a derivative form. You take any chemicals, whether it is a sodium cyanide also used in the pharma industry as a very good reducing agent in the pharma industry. Sodium cyanide. I have personally used sodium cyanide also in one of the companies. So these are the challenges of pharma industries. And when you are talking all these things, that safety, what Mohan Babu Garu is telling also, that we have to take care of all these things. So when you are thinking this is hazardous, dangerous, even regulatory body also identify pharma industry as highly hazardous industries. Most of the APIs are the red category industry, formulation are orange categories, whatever. But in terms of hazard, it is no less than whether API, whether it is a formulation, all are equally dangerous, because most of the chemicals highly flammable. If it is not flammable, it is highly toxic. It is coming everything under hazardous categories. So this is the challenges today. Really, it has come up. And what SAD is telling Mohan Babu Garu, that because of that regulatory challenge, regulatory compliance, customers' requirement, all these things, really pharma companies. For the last 35 years, I am in the pharma sector. I started my career in pharma, probably ending also in the pharma only. I have seen the changes. What the change has come 35 years and today. I myself feel ashamed. Let me tell you what I did 35 years back actually. This is the realization when I am at the end of my career. Huge opportunities there. At the same time, if you really take care, it is not like that every day getting accident. Till I am surviving, working 35 years in the pharma industry, till I am alive. That means I save myself. It is not like that. It is a risk is there. Everywhere is this. Without risk, you can't walk also. You can't drive the car also. You can't fly also. Risk is always there, but how to control the risk? That is the challenges. And that is, it is possible. 99% is possible. 1% I cannot, because it is acts of God, maybe due to the storm, due to the lightning, due to the, anything can happen. But 99% we can take care ourselves. That is what Mohan Babu Garu also telling. Today we are talking that fire safety prevention is better than cure. Whatever you take the whatever the system, the process in place, but system can deviate. It is also system. Anything can deviate sometime. Then you have the protection factor also. There is the firefighting systems, all the things come. But that is not enough today. That now second level has come automation. You have put up the system, but we don't know how it is working or not because it is not used regular basis. Now it has gone the backside. At the time of real emergency, your firefighting system not working.
Because I think there has been a lot of focus on industrial development, lot of focus on scientific development, but there has been very few forums where we had been discussing more on fire and safety. And in most of the companies, there is still a culture that fire and safety is treated more like a compliance. It's not something which is being discussed more from a strategic perspective. And most of the investments which are happening for fire and safety compliance, they are more that, okay, this is a requirement from a regulator, let's do it. It's not that, hey, this is need of the hour and we need to do it. If we look from the Telangana life sciences perspective, we are pharmaceutical capital of India. Rather, we are pharmaceutical capital of the world also if you look from that state perspective and the amount of production which we do. 40% of APIs and generics which are exported outside India, they are produced here in Telangana. We are vaccine capital of the world because 1/3 of global world vaccine that is produced here. It means every third vaccine which you see here on the planet is actually produced on this soil. And Telangana played a key role during COVID because of the mass vaccine manufacturing which we did, not just for the country, but even for the entire world. If you look from the global capability centers perspective, again, we are the life sciences and healthcare global capability center of the world. The number of GCCs which you have here in Hyderabad, Telangana is highest compared to any other city in the world. If we look at FDA approved manufacturing plants, we have got 269 plus, and that is much more than any other city, including any city in US as well. The next is New Jersey in US, which has around 190. So I think with this huge infrastructure, there comes a huge responsibility. And forums like this could raise the bar, they could raise the awareness, and they could take the discussion to the next level.
వాళ్ళ FSCI వాళ్ళు ఫార్మా ఇండస్ట్రీ మీద ఒక సెమినార్ కండక్ట్ చేస్తున్నారు. ఇది ఫార్మా ఇండస్ట్రీస్లో తరచూ జరుగుతున్న యాక్సిడెంట్స్ ఈ దృష్టిలో పెట్టుకుని అక్కడ ఎలాంటి చర్యలు తీసుకోవాలి వీటి మీద అందరూ ఎక్స్పర్ట్ స్పీకర్స్ అందరూ వచ్చారు ఇక్కడికి. ఇప్పుడు ఫార్మా ఇండస్ట్రీలో ఫ్రీక్వెంట్గా యాక్సిడెంట్స్ జరుగుతున్నాయి, దాంట్లో రియాక్టర్ బ్లాస్ట్ జరుగుతుంది, అది అగ్ని ప్రమాదాలు జరుగుతున్నాయి, మనుషులు చనిపోవడం కూడా జరుగుతున్నాయి. చాలా ఆందోళనకరంగా సిచ్యువేషన్ ఉంది ఫార్మా ఇండస్ట్రీలో. ఇది చాలా ముఖ్యమైన ఇండస్ట్రీ, చాలా ఇంపార్టెన్స్ ఉన్న ఇండస్ట్రీ. హైదరాబాద్ కేంద్రంగా ప్రపంచవ్యాప్తంగా చాలా ప్రఖ్యాతి కాంచిన ఇండస్ట్రీ ఇక్కడ ఉంది. సో దీని పట్ల చర్యలు తీసుకోవాల్సిన అవసరం ఉంది. ఈ సదస్సులో అన్నీ చర్చిస్తున్నాను, ఎక్స్పర్ట్ స్పీకర్ కూడా చెప్తున్నారు. నేను వాళ్ళందరికీ వినపం ఏంటంటే, ఇంకా అడ్వాన్స్ ఫైర్ డిటెక్షన్ సిస్టమ్స్ అన్ని యూజ్ చేసుకుని ముందే మనం అంచనా వేయగలగాలి. ఫైర్ జరిగే ముందే అలాంటి కారణాలు ఏమున్నాయి వాటిని నివారించాలి, ఫైర్ ప్రివెన్షన్ మీద దృష్టి పెట్టాలి, ప్రాసెస్ కంట్రోల్స్ ఇంకా ఎక్కువ పకడ్బందీగా చేయాలి. అలాగే అడ్వాన్స్డ్ ఫైర్ డిటెక్షన్ సిస్టమ్స్ అన్నీ వచ్చాయని ఇప్పుడు వివరించాను ఇక్కడ నా చీఫ్ నోట్ అడ్రస్లో. అవన్నీ అందరూ ఇంప్లిమెంట్ చేసి అవన్నీ ఇన్స్టాల్ చేసి ముందు జాగ్రత్తలు తీసుకుని ఫైర్ యాక్షన్ జరగకుండా చూసుకోవాలని మన ఫైర్ ఎన్ఓసీస్ అనేది మేము ఇచ్చేటప్పటికే అన్నీ తనిఖీలు చేస్తాము, అన్నీ పని చేస్తేనే ఇస్తాం ఫైర్ ఎన్ఓసీ. లేకపోతే ఫైర్ ఎన్ఓసీ జారీ చేయడం జరగదు. అది హైయెస్ట్ లెవెల్లో ఎన్ఓసీ ఇష్యూ చేయడం జరుగుద్ది. సో అవి ఎన్ఫోర్స్ చేస్తున్నాము. ఇంకా ఎక్కువ ఇండస్ట్రీస్ చేయాలి, ఇంకా ఎక్కువ బెస్ట్ ప్రాక్టీసెస్ తీసుకురావాలి. ఆ దిశగా మేము ఇలాంటి అవేర్నెస్ ప్రోగ్రామ్స్ ఈ చర్యలన్నీ తీసుకుంటాం.